All right. Good morning. Good morning. Good morning. Welcome back for another episode of Give Black, Give Back Conversations. I am Kia Jarmon, co-chair of Give Black, Give Back. We are an initiative in collaboration with the Community Foundation of Middle Tennessee. And every month we join this platform, or every other month rather, we join this platform to share more about the $11 billion annual value of Black philanthropy and to share educational tools to support the growth of our community. We have a threefold mission. One, we want to serve as a resource and amplifier of the Black-led funds at the Community Foundation. Two, we also support the efforts of nonprofits that are run by and serve the Black community. And three, we provide access and education to the community on how to build or sustain philanthropy in order to strengthen our economy. You can find more information about Give Black, Give Back at blackgivingback.com. We have an exciting conversation happening today in honor of April being National Minority Health Month. And our topic is Your Health is Wealth. Before I hand it over to my co-chair, Lisa, to introduce our wonderful panel of guests, please make sure to share this video on your timeline. So take a moment, hit the share button, put it on your timeline. Please like and comment, as well as send your questions, because if you join us in past months, you will know that we often like to bring up guest questions. So please make sure you do that. Let me turn this over to my wonderful co-conspirator in this work, Lisa Swift-Young. Lisa, take us away.
Hello, everyone. Thank you again for joining us today. This is set up for a very exciting field of philanthropy, specifically health philanthropy. And we have some really great guests. And before I get started with that, and Akia shared with you one statistic, yes, $11 billion, she did not stutter. $11 billion of philanthropy is what the Black community actually contributes on a yearly basis. And so I want to share a couple other things that tells you about a little bit more about how effective and how impactful this conversation is going to be, because the Board of Diversity of Foundations for Healthcare Conversions, it has improved a little bit in the past couple of years. About 7% of new foundations have a racial ethnic minority represented in more than 50% of the board. However, a third of foundations have no minority board members. Yes, no minority board members. Not a surprise, but definitely an issue. In the field of health philanthropy, Stanford produced a study that said only 8.4% of foundations, CEOs or presidents had diverse leaders, and 6.9% of grants actually end up in diverse communities, so Black communities specifically. So today's conversation is really around how we can make a better impact in that particular area. In our community, health is definitely affecting us. We're going to have some conversations about COVID. We have some very smart ladies and ladies who are out there making some things happen. And so I'm gonna tee this up because there's a famous quote by Shirley Chisholm: if you don't get a seat at the table, bring your own folding chair. And these ladies have definitely brought their own folding chair to their particular disciplines. So I'm gonna start off and I'm gonna let each of the guests introduce themselves. T-Bony Jewell is a pharmacist, and I will let her sort of give a little bit of background on her expertise.
Yes, like she mentioned, my name is T-Bony Jewell. I'm pharmacist at Zoran Pharmacy and Gifts in Clarksville, Tennessee. I graduated from Ohio State University, where I spent 5 years earning my PharmD and my MBA. I came to Clarksville 5 years ago, and I partnered with a gentleman who saw a need for a diverse pharmacy in the area. And that's what we're doing here, is we're trying to bring health to the community of pharmacy, or the community of Clarksville. Thank you for having me.
Thank you so much, T-Bony. We really appreciate it. And we also have on the other side, we talk about, the clinical piece as well, and where T-Bony has her expertise. And then we're going to switch over to Naila Burnett, and I will let her give her side of the health initiatives.
Good morning. Thank you also for having me. I'm grateful to be here. Like Lisa said, my name is Naila Burnett, and I am the founder of Energy Juice and Yoga, which is a mashup of a cold pressed juice bar and a yoga studio, opening our very first storefront in North Nashville later on in the next couple of months. The premise behind that, very similar to what T-Bony said, is to bring diversity, diverse representation in spaces that don't necessarily include us, but are extremely beneficial to communities that are underserved. I'm not a Nashville native. I have been here for 10 years. I'm from Denver, Colorado. I moved here 10 years ago from Atlanta. And so being in Atlanta, I got exposed to lots of different ways that businesses and entrepreneurs and the community rallied around serving underserved communities, and saw a lack here in that particular space in preventative wellness. And so to your point, Lisa, saw that there was a missing seat for me at the table, and I decided to create one.
Perfect. Thank you so much, Naila. And last but definitely not least, we have Katina Beard, and she is going to share not only her sort of background, but also she has some really great information about health disparities, and we're going to walk through that with her. And then we'll have a discussion with these ladies about how to move forward. Katina Beard, please.
Sure. Good morning. I am Katina Beard, Chief Executive Officer with Matthew Walker Comprehensive Health Center, and we have been serving the Nashville community now for over 50 years, providing medical care, dental care, behavioral health services to the North Nashville area primarily. And we all know that that's a historically Black community. And a shameless plug, we are here now bringing our seats to the table and providing our COVID vaccines here at Hadley Park to make sure that the North Nashville community has direct access to the COVID vaccine, in spite of all of the news related that African Americans are not being vaccinated. We've been here now since Monday, and we've done almost 1,500 vaccines in this community. And so it's an exciting week. So I will go ahead and share my presentation. So we're gonna talk a bit about why your health is your wealth. And we all know that we have our bodies, and to take care of that, we need to know about our situation in our community. And so I'm gonna just start with a very basic definition around health disparities, which is a higher burden of illness, injury, disability, or mortality that's experienced by one group relative to another group. And so for us at Matthew Walker, we look specifically at how our minority communities, our African-American community, our Latino community, how are we faring in terms of our health with our white counterparts? So just a few data points that I will credit to the Kaiser Family Foundation Women's Health Study. Low birth weight babies, 15% of our community, our Black women, our babies are born at low birth weight compared to 7% of white babies. Breast cancer deaths, we exceed by 7% compared to our white counterparts. Cervical cancer incidence rate. This one was interesting to me, that we have a lower incidence rate compared to our white counterparts, 6.9% compared to 7.9% in the white population. However, when we look at cervical cancer death rates, we are twice as likely to die. And so we need to understand this information and know the impact that it's having on our community, on our families, on our health, and how we can better narrate our future in our healthcare. The last one that I'll share with you, the last data point, is that during the pandemic, 38% of women of all color skipped care during the pandemic. And so if we go back just a few seconds and think about the data points that I just talked about, skipping a point of care during the pandemic, 38%, that could have been a critical appointment. That could have been a critical moment of screening or identifying a healthcare issue that now has been delayed in care. And that's the delay, the skipping of the appointment could have are attributed to various factors. One, maybe they could not have found a provider in their area that was open during the pandemic, or they just didn't feel safe in coming to the doctor during the pandemic. And so we need to understand that we have now had a year of delayed care in our community, and especially in women and women of color. So what are we going to do about making sure that our investment in our health is taken seriously? And so I talk a lot about educating yourself. People ask, well, what is the #1 factor in health? And I say that it's education. I say that it's educating ourselves about our family history. I talk a lot about the generations before us that didn't feel comfortable in sharing family health knowledge, right? We don't always know who had diabetes or who had hypertension. And when we find out about it, we feel like it was at the last minute. For example, my own father did not disclose that he had prostate cancer until very, very late. And we can all look at that and make a decision that maybe it was the healthcare system that failed or whatever, but we really do need to educate ourselves about our family history. educate ourselves about our own health conditions, know about your own health, know about what things are different in your body from time to time as we go older. Don't look at that mole or that spot and just negate it as something simple, but ask, read about other health options. You have a choice. We talk a lot in the health center about a patient-centered medical home, meaning that our patients have a choice. They have an opportunity to know about their health and to inform the provider on where they want to go with their health. Shop around. It's not anything different than looking for that best deal on whatever you're looking for. We spend a lot of time looking for the right pair of shoes, the best car, researching to know about the best hair. Research, interview, and test drive your providers until you find the right one. Again, my own personal testimony, I tell people when I was pregnant with my first child 18 years ago, my very first prenatal appointment was with a doctor. And at the end, and I asked a question. She was getting ready to walk out of the room, and I had a question. She turned to me and she was like, she really like huffed at me. And I was like, oh my. And I did get my question answered, but I went to that front desk and I asked for another provider because I know that that's my option. That's my right as a patient. So you don't have to settle. You don't have to go to a doctor that doesn't fit you. You can shop around and invest in your health, invest in yourself, invest in the time off to take the time to go to the doctor, take advantage of the free programs. There are free programs that will provide screenings for cervical cancer and breast cancer. There are free mammogram services in probably several counties across the state. Look at that, research that, and identify where you need help and take the time to do that. So I know that was a quick presentation, but just some, I think, facts about where we are as a community and our health and where we can take ownership again and narrate our health going forward.
So first of all, thank you so much for sharing that great information. I think statistics, as you mentioned before, are really an important thing for us to understand the numbers, knowing your numbers, right? So not only knowing your numbers as far as philanthropy is concerned, but knowing your own number, knowing your blood pressure, knowing your blood sugar levels, knowing, all the different numbers, prostate, right? CD4 count for other patients in particular. So knowing those numbers, we don't have to be afraid of that. And so thank you for sort of bringing that up. We know that there's a ton of different reasons that cause some of the social ills in the Black community specifically. I know you mentioned a couple, we don't talk about, what grandma had or what grandpa had, or even what we have from that standpoint to pass that on. What do you think are some of the root causes of these social ills in the Black community? Because I think to getting to the core, what are some things that you feel like that, maybe 3 things that you feel like are the root causes of social ills in our community? Katina?
Sure. I think, again, education, right? Not really understanding the importance of building good health along the way. Creating good habits, health habits early on. Training your children to go to the doctor in a preventive manner and not just as a result of some illness or incident, and taking care of your whole body. We take care of our physical body, but we may not always go to the dentist. We may not always invest in therapy. We may not always do that for ourselves. And so I think breaking some of those things that we know as Black people don't go to counseling, or, I don't want to, I'm embarrassed for people to look at my teeth. We need to get past all of those things that we've created, these barriers and challenges that we've created, and move forward. I admit that there have been incidents upon incidents of medical mistrust that are valid. And we need to understand that, and we need to talk about that. But then that's where I go back to, you just keep looking and keep talking until you find the provider that fits you. Not all providers it's not a one shop fits all situation. You really need to have a relationship with your provider so that you can have transparent conversations and feel like you are getting what is best for you. And then I think thirdly, really just setting a tone in our community, requiring more of each other, right? We don't always have to, eat and drink the way we do, or we don't always have to take in the things that we take in. I think we definitely don't always have to look for other people to narrate who we are as a people in terms of our health. I think we should be able to do that and have an opportunity to change our trajectory in terms of healthcare in our community.
Perfect. Naila, I saw you smiling a lot in there. So I saw she was like, I'm waiting to get to my part, right? So that part about like really taking control and eating properly. And that's sort of your area of expertise and where you really found in health philanthropy or in the health sector. So tell me a little bit more about what are maybe one or two things in particular that you saw in the Black community that you feel like, we're missing from your perspective as far as the juice bar and that approach.
Yeah, a couple things that I heard mentioned a moment ago. Access is one. What's normal overall in our communities, both in our households and just as a larger community. It's for me, the mission of Energy has been for a very long time to build better habits that mold better people who develop better communities. And communities to me are founded on trust, but they're founded on the ability for us to look to one another for what's going to help us to grow and develop together. And it seems like health and wellness seems to be neglected often enough, whether because either we feel like, it's not for me. Juicing isn't for me is one thing that I hear a lot. Oh, I don't like green juice. Or I can't do yoga. My body doesn't do that. I can't put my foot over my head. A lot of that is based on whether or not we actually see ourselves in these spaces. It's near and dear to my heart, as was mentioned a moment ago, to be aware of what your personal wellness journey is. I would love to say that my juicing and my yoga will prevent me from ever getting sick or anything, but it's not just that. It goes beyond that. To me, I consider wellness as a journey, and it's taking those health checks every once in a while, assessing what my body needs and adhering to that and addressing that and giving my body those things instead of continuing the destructive habits. I say all that to say that I was gifted in that I found out very early on some things that I have high risk for. I'm high risk for breast cancer, not by anything that I'm doing personally to what I understand, but it's something that developed out of nowhere, so to speak, in my mother, but it started with her at a very, very young age. She was around my age when this thing started manifesting. And had I not known that, or had she not talked to me about that now, then some of the same things that I would have continued as habits could then lead me down that exact same road. She was stage 4 when it was discovered, very first mammogram. So to Katina's point earlier, the idea of us normalizing going and getting checkups, normalizing taking better care of our bodies, both physically, mentally, emotionally, normalizing spending time assessing how we're consuming things and what impact that has on our overall well-being. It's a long overdue conversation, and it's a long overdue conversation for us to realize that we deserve representation in those spaces just as much as anyone else. It's a misnomer to think that yoga is for people who already have it well in life. It's a misnomer to think that juicing is too expensive. These are things that you pay for now as an investment within yourself and within your wellness journey, so that you do have a better chance later on. Even if you do discover some health challenges, you're preparing your body to manage through that and come out better on the other side. So I think in general, it's a matter of us being aware and being willing to open our minds and open our communities to the types of habits that will make us well together.
Perfect. That's a really great, I think, kind of some of the things you talked about in particular, as far as there's a lot of different things that we should be wary of and do research. And I think that's Katina's piece of doing your own research and finding out specifically and not necessarily taken from that standpoint. And T-Bony, from your standpoint, from medicine standpoint, that's another place where I think some of the challenges. So as a pharmacist, first of all, you're in a lead group from the standpoint of a medical professional. Sometimes we don't necessarily always include the pharmacist, but a lot of medications are necessary sometimes to manage things, or, in some cases to moderate things. So what do you feel like are some things that are still missing in the Black community that we need to address?
I want to echo what Katina said about, getting in with a provider that you have a relationship with. I noticed that when we opened our pharmacy here, There were lots of people in the Black community here that flocked to our store because I was here. They felt comfortable talking to me. You don't always feel comfortable talking to someone who doesn't look like you. So that means that you're going to hide information from that person because you feel like they're judging you. They're not going to take you seriously. But the people that I talk to, I find that there are often gaps in therapy because they're not telling me that they have, certain heart conditions or diabetes. They don't tell the full picture of what their diets are like. So when we can have an open and honest conversation, I mean, we all know what soul food is like. It's delicious, but it's not the greatest for you. So by having an open conversation about, things are good in moderation, you can identify where medications can help, or the fact that, my job as a pharmacist is to help you safely use medication. It's not to put you on medication. I actually want to take you off of it. So if we can identify places where you can, supplement, like in your diet, like Nyla said, using juices or yoga to relieve some of your stress, you can come off of lots of medications if you're open and honest with that provider, and we can get a complete picture of what it is that is affecting your health.
Perfect. I love the sort of, there's definitely a piece of where there's mistrust, and there is rightly so, but there's also a piece of empowerment that all of you guys are kind of tying in together, some things that we can do specifically. Katina, specifically, we're going to talk about COVID-19 and some things that you guys are doing as far as vaccination is concerned. And so, I just love that you guys are sort of a focus. What do you think are two key areas we need to focus on for the highest good? Like education, I know, Katina, that's sort of your piece in particular. What would be, let's just say one, what's one place, would you say education, and what does that look like, and what should we be doing differently?
So directed at Katina. I'm sorry,
Katina.
Yeah. I definitely think that education is the starting point, right? I mean, we know, well, maybe not, but health literacy is a serious issue, that people don't know how to read their prescription information. They don't know how to read their discharge papers from the hospital. We really literally don't know what some of these words mean, that we don't know what the different abbreviations and all that mean. And so it really is about education, and asking questions if you don't understand, making sure that you are clear about what is happening, what are the next steps, what is our response going to be, and just breaking away from that fear of not knowing. We still have a lot of people in our community that would rather not know. I know I don't feel well. I know my feet are swollen. I know my head hurts. I know that this is probably high blood pressure, but I don't want to talk about it, right? We don't want to talk about it. And and this has been a conversation now for 20 years, our fatalistic views in our community around, if we find something out, then that automatically means we're gonna die. And that's just not the case. I mean, it's an opportunity to heal and to be restored. And so I think education on all fronts is where I would say is a starting point.
Naila, specifically, what do you feel like is something that people can do differently to sort of address this issue on their own, that can empower them?
I think accountability has been something that's a theme for me in my wellness journey. To Katina's point, when I found out that my mother had stage 4 breast cancer, the very first thought was, I'm going to lose my mom. She's too young for this. I'm too young for this. But she had a support system around her that helped her through it. And she's 9 years free of cancer. She's 9 years in remission. And had it not been for her having a support system around her, who they themselves also weren't afraid of the journey of overcoming cancer, it made it so that she saw an end to it. It wasn't mortality, it wasn't fatality, it was she saw herself coming out of it. Mm-hmm. Another example for me is when people come to me about juice cleanses, there's so much concern around, oh, can I do this? Oh, what do you mean 3 days with no food? How am I going to do this? But the conversation starts. Then I can tell them, hey, here's an experience that I've had while I was on a juice cleanse, or here's an experience that someone else has had. And it starts to peel away the layers of fear. And then people are more forthcoming about why they want to go on a juice cleanse. They're more forthcoming about what they want to feel after their juice cleanse. But it starts with them having somebody like was mentioned a moment ago that they can talk to before and during the process. And I think just being able to have communities of advocates that are willing to hold people accountable to what it is that they need to do to overcome it, whether it's from identifying it or getting through it, and then having people that can rally around, empathize, and support so that they can come out of it better. There's so much that you get from having someone that's a support partner along your wellness journey that I think in general, instead of us running away from it and saying, oh, that person has the sugars and that person has this and that, if we can bring ourselves back to that communal point of supporting one another, that goes a long way. It goes a very long way.
Perfect. Kia, I know you've been taking notes, so I just wanted to give you an opportunity to hop in there and ask a question or make a comment.
Yeah, I always got my pen and paper because I love to hear, the educational piece of this. So I have lots of great quotes and I'll bring those out. The question I have, what I have to bring into this conversation, particularly from an education and historical standpoint, is we put a lot of ownership of these challenges on individual people. And I think it's important, right? I believe it's important for people to be held accountable and to go in, go to a doctor's office with someone so they can take notes with you. Like all those things are really important. I also, though, have to hold accountable those folks who are listening on the call with us and who will listen later, who are practitioners, who are legislators, who get in front of lots of people, pastors, and those folks who can hold accountable lots of people who can be system changers in some way. Let's talk to them, because putting the ownership just on one side, which is the person who has typically been oppressed in some way, is okay, but not always helpful. So how do we also make sure that those folks who are system changers, they have some tools? So what will we share with them? So what are a couple of things we can share with, again, I'm looking at the line now, I can see some folks who are on, those legislators, educators, pastors, folks who get a chance to change rules, make laws, doctors. How do we make sure that they have the tools that they need to be more, that they change in some way towards this process? So we're not just putting ownership on one side. And I don't think that's what you're saying, but I always have to bring that into the conversation. Whoever wants to jump in and answer.
I can jump in and say, humanize the statistics, put faces, meet the people who are dealing with it, who are going through it. It's not about the numbers, it's about the lives. And when you have the opportunity to have those face-to-face conversations, not only with the person who might be facing it, but the community around it, whether that's the household or individuals who are impacted by that person's, whatever that health challenge may be, you have to meet them and understand their lives. Understand that people don't just run out and decide, hey, I'm just gonna eat terribly all day long so that I can get diabetes. I'm going to stress myself out all day long so that I have hypertension and high blood pressure and high cholesterol. That's not what we want. We don't want that for ourselves. We don't want to be in the disparate situation all the time. We don't want to be behind the curve. We want to live prosperously. We want to live healthily. We want to live and enjoy our lives. And we don't want to always have to be the persons bearing the brunt of the work to get ourselves better. Support us and ask us what we need, and then meet us with what we need, as opposed to just reporting the statistics. Whether that's putting more educational opportunities in places where we already frequent, schools, banks, hospitals, wherever we are, or if that's you being in the room in a yoga session, hey, I'm here doing this with you. If that's you doing a juicing session, I'm here doing this with you. Humanize us. We don't want to be in these situations. We're doing the best we can with everything else that's on our shoulders. Support us and be there and meet us. That would be my suggestion.
So I'll just add to that. I mean, Kia, you're of course absolutely right. There are other determining factors, and we talk about the social determinants of health, right? That our health is impacted by where we live, where we work, where we play. So do we have greenways? Do we have sidewalks? Do we have, are our schools healthy? And so I had the pleasure of listening to a presentation about a month ago from Daniel Dawes out of the Sasser Institute that talked about the political determinants of health, right? Parks don't just appear. Sidewalks just don't come up out of the air. These things are determined and based on policies that are created by our leaders. And so when we talk about why situations are the way they are, to Nyla's point, nobody wants to live in a neighborhood that doesn't have sidewalks. No one wants to live in a neighborhood where they have to walk so far to get to the bus stop. No one wants to live in a community where they only have 1.5 grocery stores. And I say 1.5 grocery stores because you have a major grocery store and you have a small grocery store that you're not sure where this food comes from or if it's fresh or that you know the expiration dates are real. Those are all policy-based decisions that are made. And so we continue to talk about food deserts in Nashville, and there has been nothing done to resolve that. We continue to talk about where there are a lack of sidewalks, and we've seen where sidewalks have been replaced over and over again, but no new sidewalks have been put into certain communities. We talk about certain communities having crosswalks in places so that people can cross the street safely because of pedestrian deaths. But there's a lack in other communities, and you can see that. Those are policy-driven decisions that are absolutely beyond not beyond us, but impact us as individuals. And I think what we need to do is that we need to identify individual leaders that are educated, knowledgeable, are not controlled by any particular group of people, Black or white, that we can see larger than ourselves, and that we can move past this, what I consider circular conversation that goes on to actual results. So to your point, yes, there's only so much as an individual that we can do, but we need to do all that we can do in our individual selves to change the trajectory of our health. So to Nyla's point, her mom had stage 4 breast cancer. So she knows, don't wait to go get your mammogram. And don't be frustrated because you can't go right down the street to get your mammogram. Go as far and hard as long as you need to get your mammogram. So we're fighting 2 fights simultaneously.
So T-Bony in particular, so when we're talking about pharmacy around that, so what are some things that to Kia's point, what are some social challenges that you see that need to be addressed in your, whether or not it's patient assistance, as far as program, as far as being able to afford medication? What are some things that you're still seeing that from a higher level we need to address? We have the Affordable Care Act, we have different programs out there. What are some things that you're seeing that philanthropists, people who can make policies that need to be addressed that are not being addressed right now?
I think time spent with providers is a really big thing. Most people know that heart disease is a silent killer, and that's because you don't exhibit symptoms until it's too late. So I can counsel a patient on taking their medication daily. They're not feeling these symptoms. My blood pressure is high. I may have a headache, but other times, they're going through life with high blood pressure and don't even know it. They're going through life with diabetes and don't even know it. So adherence is a really big issue. So we need to educate people about adherence to their medication, taking it every day. Even though you don't feel bad or you're not exhibiting symptoms today, you still need to take that medication because it's preventing complications down the line or preventing your disease from progressing. And I think a lot of that comes with, sitting down with your medical provider who's starting that medication. Spending 15 minutes with a person is not going to help if they have lots of issues. And that's typically where I see the most problems, is that people who have multiple conditions, they don't have enough time to sit with that provider to have everything explained to them, the importance of the adherence to medication, their side effects, and, how things can be combated. So I think we need to stop pushing, 50 doctor visits in a day. Cut those doctor visits down so that you can spend enough time with that person and don't be annoyed with them when they have, multiple questions. Not everybody has the same education level. So we have to be kind, we have to be courteous, we have to understand where they're coming from to answer those questions. And I think some, healthcare policy around payment and reimbursement to our healthcare providers. That's where things start. You know, we end up packing, and I know this is true to some clinics around here, they pack their days full of visits because they need to see a higher volume of people instead of giving a greater quality of care. And so that's what I would say to legislators is let's talk about reimbursement rates for these providers so that they can spend more time with their patients and give better information.
So great. So first of all, thanks so much for that from that standpoint, from looking at 3 different ways or a couple of different ways to look at it. So how can we, you know, to Kia's point in particular, so how do big organizations, you know, here we have St. Thomas, we have Ascension, which is the parent company from that standpoint. We have, you know, large healthcare organizations. How do they, what is their role in instilling trust in the healthcare system? Katina, I know you probably have some experience in this area.
Sure. I mean, I think that we are becoming clearer on the importance of diversity and inclusion in our staffing, in our areas of decision-making, so that we aren't having these kind of siloed conversations or perspectives. So I think making sure that we have diversity in our organizations, that we look at our policies and identify those places where we know that there's systematic racism, where we know that our policies are set up to defeat certain communities, particularly communities of color or communities of non-English speaking patients. I think taking a good look, and I will say, you know, being on this side of that conversation, we're getting there. It's not anything that's perfect. Providers are looking at how do we provide better care to our patients? What are our policies? How are they affecting our ability to better serve our patients? And so there are several groups talking about it. Has it been totally ingrained and manifested in the larger organizations? No, because, you know, it takes some ownership. It takes some, you know, some self-reflection, some calling out, some accountability, like we talked about earlier. And so I think that's a long road to go, but it takes all of us having that perspective and looking at ourselves critically in this space. I think is one of our steps.
Perfect, thanks. So we would be remiss if we did not address the disparities. I mean, I think, Katina, in your presentation, you talked a little bit about the disparities as far as distribution of COVID-19 vaccines. I've been on, and I'm sure all of you guys have been on plenty of health panels that show specifically that the vaccines up to this point, at least, have been disproportionately to other communities and not Black communities specifically. So as we roll out, you know, a lot of organizations, I know the organization that I'm affiliated with, we're about to engage upon sort of a distribution of the vaccine en masse. What are some things that we can learn or we can take to them and say, these are exactly the things we're talking about, right? The disparities that exist. What are some things that you think need to be addressed when we do this massive rollout? I think the government is calling for a massive rollout in the next week or so across the country. What are some things that you feel like will close that gap that currently exists? I think the numbers right now, by far and away, Caucasians have more access again to the vaccine and are getting the vaccine at a much, much higher rate than African-American and Brown communities. What are some things that you would tell the people who are making the decisions right now to distribute the COVID vaccine to do differently than they've been doing? T-Bony?
That's a great question. If I'm being honest, I'm not sure where to start. There are so few people in the community, from my understanding, that want to get the vaccination. I had a long conversation with my mother the other day. She's one of those high-risk patients that needs to get the vaccine, and she's too afraid to get it. And so just talking to people, gauging the interest in getting it, and then let's start with, you know, how can we congregate all of those folks in one area that we can come out and do a mass vaccination event? So if it's going to places where we know that, you know, people of color are going to gather, so like churches, reaching out to church leaders and to have physicians or pharmacists, nurses to come and talk to those folks so they feel more comfortable getting the vaccination. believe that I end up convincing my mom to get the vaccine. So she has an appointment coming up. We'll see if she cancels it or not. But I told her I got it. You know, for us, we need to be examples. I got the vaccine. I posted my journey of side effects and symptoms to let people know that, you know, you may have some side effects, but it's better, you know, than actually experiencing the disease and, you know, possibly having to go into the hospital, into isolation. So reaching out to, like I said, to folks who have greater access to people of color who want to get the vaccine, and then convincing those with, you know, educational knowledge to get it, you know, we can start some mass vaccination events.
Perfect. I know at Matthew Walker, you guys have some experience in this area.
We do, yeah. So I spoke earlier that we are here at Hadley Park with our Johnson & Johnson vaccine, and we are here until tomorrow. And so if people want to come out and get their vaccine, I would just ask you to be here by 3. We'll be here from 9 until we leave at 4. So we ask you to be here by 3. But she's correct. People don't want the vaccine. You can't, it's a personal decision. You know, it's not, you know, from my perspective, and I'm not sitting at the top of the perch looking, but I've not seen anyone withholding vaccines from the Black community. I've just not seen that. I've seen where we've all been struggling to keep up with the shipments out from the manufacturers and whatnot. I think one thing that we can do is we can partner better with minority serving organizations to help them facilitate the rollout of the vaccines. And so we partnered with faith-based organizations to immunize their congregations and let them be the trusted face and messenger of the vaccine rollout. But one thing that I want to point out is, yeah, African-American, Latino community, we may not be being vaccinated as highly as other communities, but we fail to mention that the rural community is not being vaccinated. I have partners that will not take the vaccine because they know they won't be able to push it out. We have people who are on the conservative spectrum of the political views who are not being vaccinated. Those conversations are not being held as highly as it makes it look as if the Black community is either denying or being denied something. But this vaccine rollout is a problem across many populations. And so I am just a little, you know, I just want us to have a full spectrum about the vaccine rollout, and that there are lots of communities that don't want the vaccine or are hesitant to receive the vaccine. So to Tiffany's point, what we need to do in our community, again, is to be a trusted face, provide education, help people come to the decision on their own, because the worst thing you want to do is push somebody into doing something and then, you know, and then it's like, oh Lord, you know, what do we do? So you want to educate people. You know, I've been having conversations with people. You know, we had one gentleman come in and he literally wanted to see the vaccine vial because he wanted to make sure there were no little robots in the vaccine vial. We showed him the vial. He still didn't get his vaccine. I mean, it's not that the vaccines are not here. We're here with a goal of 500 vaccines a day. Yesterday we did 450. So we're asking for people to come out to get vaccinated. And so, but it's a personal decision, and I respect that. I completely respect your mother's thought process around getting the vaccine and that of others. But I think we need to be very clear that it's not just the Black community. It's a lot of communities that are not receiving this vaccine.
You're right. So from that standpoint, you know, the numbers, you know, I'm obviously, you know, we're a organization, Black Leg Foundation, so we focus on the Black community specifically. So I did not mean that disparately, meaning that other communities not. My primary concern in our sort of initiative is around the Black community and what do we need to do to make sure people, to your point, have the education. And am I hearing that that the rollout has not done a good job of educating people so that they can make an informed decision? And it's more of that. Is that what I'm hearing? So what do
yes, I would say that. I would say from the start, that's where I wanted to start before the vaccine even came out, is to educate people about the vaccine, what it is, how it was created, what it will do, what the side effects are, just really providing that education. And so we're running that track at the same time, trying to vaccinate people and educate people at the same time. And it's working. I mean, to be able to be here in North Nashville, providing this vaccine to a community is a great impact, I think. And I think it shows that there is a willingness for the Black community to come around and collaborate in this work. And so it's not just, I say it's Matthew Walker, but it's Matthew Walker and Connect Us Health and the health department and so many other community partners working on this to make this effort happen. And so I think that's what we need. We need more collaboration in our communities around educating and around providing access. And so I think we have that now. Earlier on, it was difficult because of the type of vaccine that was out. Everybody couldn't distribute that particular vaccine. But now that we have the other two vaccines that are much more easily stored with providers like myself and others, it's an easier method now to get it out to the community.
Perfect. Kia, I see you shaking your head a lot in agreement or also questions, any sort of feedback on the COVID. So what I was really hoping, that we would be able to do is so there's some systemic issues that are happening. We've kind of gone through the gambit of the reason, we didn't mention the Tuskegee experiment or the gynecologic atrocities that happen in order to get some of the medications and tools that we have right now that happen to our community specifically. So we've addressed some of those things in particular, but moving forward in this opportunity, what do organizations need to do differently? In education is where I'm seeing this is something that's systemic. Again, it goes back to not getting the information, not getting the full data, to Naila's point, not even understanding how, yoga or eating properly can actually play into that, and sort of having that coordinated approach. And so, Kia, I know you have some comments or some thoughts on this process as well, of what organizations really should be doing differently now that will address not only the COVID-19 issue, but the health disparity across the board.
Yeah, well, I always have thoughts. They're never to take away. I want to make this clear from Black women experts. So we have experts on the line who have made really invaluable points, I think. Because I work on this from the other side. So meaning I'm outside, I'm not a health professional. I do community engagement, communication, strategy. So, but I am working across the state with some of Katina's partners who, you're absolutely right, are rural and have great amount of challenges. We're hearing some of the same things. One of the things I shared with a West Tennessee practitioner the other day was, listen, if grandmama and granddaddy and auntie and church leader will call their younger folks in the community and call them out, it would be helpful, right? Because it's only so much that anybody on this call is going to be able to do to encourage younger people, because that's really, there's some huge disparities in the numbers. Those who are super at risk, 65 plus, just based on the data I've seen, are not having as difficult of a time going to get the vaccination. Everybody else who might wing it, who already before the COVID-19 took place, were not showing up to the hospital or the doctor's office. So men, and in particular age groups, and then of course, particular pockets of our community. So again, not just Black folks, not just people of color or brown people, but like all people who just weren't showing up, period. They're not showing up now either. Same type of thing. But I said, listen, if we can find credible messengers, right? Credible folks in the community. And usually if if your grandmother calls you and says, I need you to go do this, then sometimes you listen a little differently because they have different perspective. And really what you're seeing, I'm on this kind of one band campaign to get people to be better neighbors and be better community members. And the way we do that, regardless of I want to be very clear about this. This is not a pro-vaccination conversation. This is a pro-education conversation. So I want to be very, very clear. Personal beliefs have to be aside in this conversation, right? Like I want people just to go get educated about what they should do. But what I will say is that it has to, we're gonna have to look at this a little bit differently. One, we have to do education outside of a crisis. Like we're in the middle of a crisis. You don't build trust in a crisis. You triage in the middle of a crisis. So that's one thing I would say, is that although we are outside of kind of COVID being month one, we have not still done a good job of giving the proper tools to everyone to feel comfortable. And I'll tell you what the chief piece is: communication, right? Like We just, if the main places where we get our communication, whether it come from, you know, that building in Washington, D.C., where the person who leads our country is supposed to be, or whether it comes from the person who leads our city, if we are receiving or not receiving a certain amount of information every week, then, or if it changes every week, but there's no one to say, it's going to change. I'm gonna come back in a couple weeks, it's gonna change. People want transparency. What I said about my own vaccination experience was, I'll just tell people whatever it felt like. Like if my arm fell off, I was gonna tell people. Because I wanted people not to be thinking you're gonna walk in and have some amazing experience and then you don't, or you are gonna have an amazing experience and you did. Like I didn't have a bad experience, but I don't take away that someone else may have literally had a challenge. So we've got to really be in the education business, and where education starts for me is always history. Because if we understand why this happens, right, why we get into this situation on every health disparity, this is not just COVID specific, this is every health disparity. If we really understand the history, a doctor once told me one time, he said, do you understand why people take water pills? And I was like, well, no, but my mom takes it. And he said, because can you imagine having to be brought on a boat, a ship, from Africa to America, and how long you might not have access to water, so your body has to hold water? I said, okay. I was like, that makes sense, right? Because our bodies haven't necessarily adapted to the different environments all the way. And so I was like, that makes a lot of sense to me, right? Whether it's, I mean, I don't take him for not being the truth. He was a doctor, he said, but the point he was making was, historically, we've had things in our past. Our great-grandparents could eat pork chops and egg and greens in the morning because they went out and worked all day. We lead sedentary lives. We're in different places. So we got to understand education from history. So I would say that's the biggest piece that we're missing, is people being able to communicate very honestly, those trusted messengers, those Black-led organizations being listened to and valued in our community, not just minority, because that means minor less than, but Black-led organizations, right, that are credible messengers in our community. They're valuable people. We got 3 of them on our call today, and there are many, many more in our community. If we look at them and say, let's call them after we've done the distribution and not before, then we're still seeing the community as less. But these are the people who can tell you, before you start opening up vials and sending them out into the world, call them. So that's what I think part of our conversation has to be about today too, is helping them, the general public, understand these are your faces of people you should be calling to say, before we go out here and make a mess of it and you got to clean it up, because that's what Black women have to do. Hello? I want to make sure that we really call them first, because we can protect you on the beginning and not have to do it on the end. So I'll stop, I can sit here forever on this piece, but I think our experts we need to hear from them more, but that's where I am in terms of the education piece. We got to do it when it's not COVID. And we got to keep coming back and doing it over and over again. Not one time when you got a couple dollars, all the time. Come talk to the community. Come share with the community. Come give to the community.
I think you're exactly right. And that's why we're sort of advocating Black-led foundations specifically, because these foundations have a vested interest in the community, and we're coming to them before. Granted, we're in this situation now. So as we always do, you make it work with what you got, right? But taking these opportunities and experiences and bringing our seat to the table, and not, getting rid of the folding chair and taking the CEO chair, taking, those particular seats, get on board members, becoming active in the community, and sort of pushing these organizations to say, this is this opportunity where they may want our support because they're trying to get information in, but getting those seats at the table, again, mentioning the boards or starting your own foundation. There's a ton of foundations that are already out there, but if there's not a health philanthropy foundation, you can start one, and we can, help. This Black Giving Back is really about helping philanthropists sort of make an impact so that we do address the legacy issues and the historical pieces from that standpoint. So I know we're getting close to time, and so I want to be respectful from that standpoint. So I wanted to have you guys sort of share, if there's one organization in Nashville already that people should reach out to or support with philanthropy dollars. Because obviously money starts to move this whole piece. I want you guys to share that with the people who are listening, so that they can make these changes now for COVID-19, and also we can start building a legacy to start addressing some of these systematic racist issues out there. So I'm going to start with you. you, T-Bony, if you have an organization or a place you feel like people should spend their money. So people who are out there wanting to now like fix this issue, where do you think they should go?
I actually don't have a particular organization in mind. So if anyone else would like to step up and point me in the right direction, I can start to contribute to one of those organizations as well.
Perfect.
Of course, we're going to say Matthew Walker. Health Center. We got to say Matthew Walker. They're not just doing the work of the people and of the Lord, okay? So we got to make sure that we get Matthew Walker in there. And I know Katina is going to jump in, but I want to jump in before. Because Matthew Walker, just give a little history, Katina. I'm sorry, Lisa, to step on you, but I have to give a little history about Matthew Walker and how long I've been really championing it in the community.
Yeah, no, we were founded by Dr. Matthew Walker Sr., who was fundamental to the civil rights movement here in Nashville. He bailed freedom riders out of jail. He fed them on Sundays. He went to Mount Bayou, Mississippi to train Black students at the time because they could not be trained in the hospitals in Mississippi. He brought this health center model back to Tennessee, making us the very first founded, established community health center in the state of Tennessee. And so we absolutely ask you to continue to support our mission, which is to provide quality health care, health education, and promote wellness in our communities. We serve over 17,000 people a year in Nashville, Clarksville, and Smyrna. We are fighting the good fight of access for all, particularly minority communities, particularly uninsured minority communities. And so if you want to know more about us, you can go to our website at mwchc.org. Come by and visit us, make an appointment with us to see a provider. We have African-American physicians, nurse practitioners, therapists, dentists. We have, we're a diverse organization. And so come out and see us and know more about us and learn more about your own health. And so thank you, Kia, for jumping it off. But yeah, we are the organization if you want to just give today.
We want to make sure we're highlighting organizations. So yes, definitely Matthew Walker from that standpoint, that entire, Meharry and Matthew Walker and the connection that is in there is obviously one of the places where is near and dear to my heart as far as an HBCU specifically, and all the HBCUs here in Nashville, I should say. But around health, those are the premier organizations. So if anyone's not familiar with either one of these organizations, please, reach out to them. And these are Black-led organizations that are addressing some of the health disparities that we've had a discussion about. Naila, I want to give you an opportunity. If you have an organization, I want to make sure that we give them some attention and make sure that they, people know that they can make a difference by making a contribution.
Ditto absolutely to Matthew Walker and Meharry. And I think further to the point of, we started about overall disparities within our communities, organizations like Gideon's Army, Equity Alliance, Stand Up Nashville, even down to Studio Bank and Citizens Bank, New Nashville Emotional Wellness. These are organizations that are the boots on the ground that are doing the work to address the types of
Did we freeze?
I think so.
Okay. She was on a roll too, so I hope she comes back. I'm sure she will in just a second. Get back.
I don't know if it was me or her. Okay.
Yeah, no, I think that's okay. She was giving some really good organizations. Just to recap, I think I heard her saying Gideon's Army, Studio and Citizens Bank. There was one other organization I hope she comes back and says, because I want to, I know Kelly can put that information in the chat for us before we get off. So
perfect. Well, I want to thank, there she is. There we go. So we want you to run through. I think we got most of what you said, but I think he had kind of recapped Gideon's Army, obviously Meharry and Matthew Walker, keeping them a Studio Bank. Anything else that we missed? Any other?
Yeah, I also mentioned Equity Alliance, Stand Up Nashville, and then New Nashville Emotional Wellness. These are organizations that are the boots on the ground that are doing the work to help to bring us collectively into the conversation and that we're considered. Those are places or these are organizations rather, that also need the philanthropy dollars and the attention, because we're pulling other parts of the community forward as well, so that they don't culminate into health and wellness disparities. So yeah, That's what I said before my phone crashed.
Okay, that's fine. So this, first of all, ladies, thank you so much for taking the time out to speak with us today and sharing with y'all, with the audience specifically about health philanthropy and what can be done and how we can address. And, I want to thank all of our guests for bringing their expertise and their knowledge and their faces to the spaces, because I think all of those things are going to be things that we will be able to carry from this current situation into the next situation, so that, Naila, your daughter or son or grandchildren or whoever are benefiting from that. And that's what really philanthropy is about. Really, it's about taking what we have right now and making sure that the legacy of our community lives on in a better way than we left it with. And so health philanthropy is definitely something that will address a lot of the issues, or one of the issues in our community. And so if you are familiar with health philanthropy, and if you haven't been, then do some research on it, look up some things. In particular, we are here to support you. As Kia mentioned before, we are always about, building philanthropists, supporting philanthropists, and then ultimately working with, organizations that want to receive funds as well. So if you are that, here's the deal. Go to blackgivingback.com and you can find out about all the current organizations that are in at the Community Foundation of Middle Tennessee specifically. And you can get more information. You can see bios on Kia and I. You can see a lot of the links to the other talks that we've had over the past couple of months. We are so thankful to have all of our guests. I want to make sure that we also thank some people behind the scenes that you don't see. We have Audrey Cox, who without her at the Community Foundation, we would not be on this format. So we want to always make sure we lead her in a way, support her in a way that she continues to do the work she does. Also, Kelly Warburg is doing a lot of the audio and communications information in particular at the Community Foundation. Everyone there, Ellen, April, everyone there, we want to thank them for allowing us to use this platform. Blackgivingback.com is where you go to support any of these organizations that you've heard about today specifically. Join us in June, I guess from this standpoint, we are gearing up for an amazing conference or conversation with the National African American Music Museum. And we will be featuring them for Black Music Month in particular. So make sure you subscribe to either or join our Facebook group or subscribe to our YouTube or follow us on all the different platforms that we have, and Kelly will get those out as well. I want to also note that we have a line of t-shirts that our co-founder is sort of supporting as well. So she's wearing her philanthropist t-shirt. And so you too could be a philanthropist and so support Black organizations that way as well. I want to thank everybody for being here and taking the time out to speak with us today. Kia, if you have any closing comments or have anything in particular to wrap us up, I'll let you close us out.
Yes, I do. Thank you so much. Yeah, you can go to kiajarmon.com/shop. That's where the shirts are. And sweatshirts, and I'll have t-shirts up soon. But a few things are really important. I was talking to a colleague yesterday, and we were talking about health in all policies approach. And so that's really whenever you're making public policy decisions, think about having health as an opportunity to talk about everything. If you're talking about housing, you're talking about transportation, bring health in all those policies. That's going to be really important so that we don't just have these disjointed conversations. As Katina said, she's been talking about this for 20 years. I'm sure prior to that, we've been talking about it for 120 years. So let's stop having this cyclical conversation. I also want to invite you to the Big Payback. If you're a nonprofit in Nashville, you know about the Big Payback, May 5th and 6th. Give Black, Give Back will have its own page this year. And then also we have many nonprofits and Black-led organizations like Matthew Walker and others who will be participating. So we really want to make sure that you come to the bigpayback.com so that you can learn more about the Big Payback. Lisa already said all of our thank yous. Thank you to those guests. I've been keeping an eye on Facebook. Make sure that you still share, like, and comment. I want to give, we have a few minutes, but actually, Naila, will you give us a very simple place to find you, and then also a very simple juice or smoothie or food thing that we could do to go throughout our day? I want to give you a little space to do that.
Yeah, absolutely. We are on Facebook at inner space, the letter G, juice, ampersand yoga. Instagram at energy_juice_yoga. And our website is www.energyjuiceandyoga.com. Energy is spelled I-N-N-E-R-G. There's no E, there's no Y. In terms of something simple, I always love simple juices that are with flavors and ingredients that you already like are familiar with, right? We can do like a cucumber, apple, kale juice, super healthy, super beneficial, lots of very, very hydrating for you, gives you lots of good vitamins, electrolytes, nutrition. It's just a good juice. That's one really simple one, doesn't take a lot of time to make, and it makes a lot of juice. Another, don't be afraid of beets. If you do just a beet orange, that's just really simple and delicious by itself. Add a little watermelon to it and you'll forget the beets are there. So just a couple, those are ones that go through the juicer very easily and give you a lot of nutrition very easily.
Thank you for that, Naila. I just wanted to make sure. And then T-Bony, did you give your information? How do we find you? And then we can get out of here.
So if you have questions and you need to speak to a pharmacist about your medications or anything, you can give me a call. Our number here is 931-542-4632, or you can find us on Facebook, and you can search us at Zoren Pharmacy and Gifts. And Zoren is spelled Z as in zebra, O-R-E-N, and that's Pharmacy and Gifts.
Awesome. And that's not a background or a backdrop. That's actually where she is. She's been working. That's why she's been stepping away. She's been taking care of patients' needs. And then Katina, tell us how long you're there again, today and then tomorrow, so people can come see you.
So today and tomorrow, we're here until 4. We ask you to show up at 3:30-ish if you want to get a vaccine. And so we're here at Hadley Park Community Center. You'll see our big mobile unit outside.
Awesome. Thank you. Thank you, Lisa, Audrey, Kelly in the background. Really appreciate you all. And have a great rest of your day. And of course, give Black. Thanks, guys.
Thank you.